Welcome back to the Sports Med Minute. I'm Jeff Saman, physical therapist from Northern Michigan Sports Medicine Center. This is part 2 of our conversation with Dr. Todd Sheperd. Dr. Sheperd is a specialist in family medicine and also in sports medicine. And we were talking with Dr. Sheperd about golf injuries, and for this part of the interview, we'd like to talk a little bit more about golf injuries in the back. So Dr. Sheperd, you were mentioning that shoulder injuries, elbow injuries, wrist and hand injuries occur, but you said that back injuries are one of the most common that you see in golf. What do people normally report to you when they have golf injuries like that?
Well, actually, a famous golfer, and I can't remember who it was now, but he used to say there's two kinds of golfers. There's golfers who have bad backs and golfers who are going to have bad backs. Mm-hmm. And in reality, in primary care, we see tons of back problems. So it's probably no surprise that golf has, it's more than its fair share of injuries. But typically what I mostly will see is lumbar strains, which is a low back muscle strain. But also you can also have some relationships to the disc problems. And some people, as they get a little older, will also even get some wear and tear arthritis in the spine, all of which can cause problems with pain in the back. The most common by far, though, is it's sort of low back pain. Typically with golf, we see a lot of low back pain. We don't necessarily see a lot of acute injuries to the disc where they're going to have shooting pain or weakness down the legs. But most of the time, it's just related to the muscles of the back.
Okay. So when I'm out there on the golf course and I make a nice drive, hit a good 250-yard shot, and kind of after the next couple of minutes, I start to feel this kind of nagging sensation down in here. I kind of want to hold it and support it. What are some possibilities that could be?
Well, what you're describing is pretty common, and most of the time I would say it's a stretch injury to that muscle where the muscle's gotten. Typically, it's a microscopic thing. You can't take necessarily an MRI or an X-ray of it and see that there's been a tear in the muscle, but at the microscopic level, some of those cells have been damaged, and they send out a signal of pain, which often leads to a lot of sort of a stiffness or a guarding, and that's where you feel that tightness, okay. Where your body is almost into protection mode and it doesn't want to move to protect itself from further injury.
Now, let's say that I have those types of symptoms. I don't have something that would indicate a disc problem like numbness or tingling running down my legs. I don't have anything else going on, but it's really been about 2 to 3 weeks, and this problem just isn't getting better. It's limiting me during my work activities. It's hard to get in and out of a car. What should I do at that point? What can be done for me?
Well, typically, when people have an injury, 2-3 days later, we typically encourage ice in the first 72 hours. Later on, you can start to introduce heat. Anti-inflammatories or Tylenol can help with pain. But if it's been hanging on for 2 or 3 weeks and it's not seeming like it's going away, or if there's any other changes or symptoms, that's the time when I do want people to come and see me. Because once in a while, it's more than just a stretch of a muscle, or it may require more than just a little bit of a tincture of time. So in 2 to 3 weeks is actually a pretty good ballpark, because most of the time after 2 weeks, if it hasn't gone away, you're going to need more than just those things.
Okay, and what's the next step? What happens after that 2 to 3 week period? What do you recommend?
Well, typically, folks that come to my office, I'm going to do a thorough history. Really want to pin down what problems they've had with their back before. Also, if there's any family history of back problems, those types of things can be real helpful. And then again, trying to really narrow it down to where is the pain, how do you make it better or worse, and how did it start? And then after that, we complete the physical exam. The physical exam is to help make sure there's not something that's a red flag for something more serious, like some injury to the bone itself, or herniated disc, or some type of trauma to the nerves. And assuming those things are all appropriate and are not appearing to be something more serious, 2 to 3 weeks, I would consider definitely doing a plain X-ray just to make sure there's not a bony problem. It can also give us some suggestions about the health of the disc, although it's not as good as something like an MRI for the discs. And assuming that that's normal, then I would move to something a little bit more intensive in terms of therapy. And specifically, formal physical therapy is usually where I go with that, because, again, after 2 or 3 weeks, if it's not getting a lot better, then there's probably more intensive treatment that needs to be done.
Okay.
And, most of the time when you guys start to take over the care, you're going to start really looking at the physical function of their legs, their lower back, their abdomen, really honing in on every single little aspect of their day-to-day function, in addition to being very aggressive and trying to get rid of the pain that's already been generated.
Right. Okay, so we've talked about some specific things and what to do. What are some general things that I can do before I hit the golf course that are going to decrease the chance that I'll get injured?
Well, the weekend warriors are the ones that I see most often with this. And if you look at the amateur level golfer versus the professional or elite golfer, there's a tremendous amount of more energy that's sent through the lower back in the amateur. And again, I'll go back to this time and time again when it comes to golf especially, but I think in any sport, if you have efficient use, efficient form, you're going to reduce your chance of injury. Beyond being efficient in terms of your stroke or your swing, having a base that's of strong, core strength, good flexibility. 99% of the time I see guys that are, in their 40s or 50s in my office, they have terrible flexibility, and they expect their body to behave like it's 20 years old, where they can go out and not do something for a week, jump right into it, and then be fine. The reality is, as you get older, there's certain things that just happen. If you use it, you lose it. Flexibility being one of those things.
How soon before the season should I start doing those types of things? I mean, do I want to go 6 months ahead of time? Do I want to do 2 weeks? What do you think is best?
2 weeks is probably not enough. I think that's at least a minimum of about 6 or 8 weeks you need to be getting into a program. If you have the time and the resources, it's always helpful to have a 6-month program to get yourself ready, because you're just going to be that much more likely and you can go at a more gradual pace. But 2 weeks definitely I don't think is enough. You're not going to see those changes in your body that are going to help be protective.
So one thing we tell people in physical therapy is that it takes about 6 to 8 weeks to really build muscle. That would probably be a good lead time for that type of program.
Yeah, you're not going to see those kinds of changes until about that time. So even in the best of circumstances, it's not going to be a 1 or 2 week process.
Great. All right, thanks Dr. Sheperd for sitting down and talking with us.
Thank you.
Appreciate it.
My
This has
pleasure.
been your Sports Med Minute, brought to you by Northern Michigan Sports Medicine Center. Thanks to Dr. Todd Sheperd for filling us in on different types of golf injuries.